I think fear overcomes stigma. I mean, people are like, there's something wrong with my dad, or there's something wrong with me, and I want to know what's wrong with me, and so they're willing to. I usually just don't deal with stigma.
I think, going on Marwan's point, oftentimes what is happening in the primary care office, which is oftentimes the entry where most patients either may begin to discuss memory concerns, they're oftentimes, it's hard to parse out how much stigma plays into the fact that the physician oftentimes will give some diagnosis of cognitive or something more vague than Alzheimer's disease. And so you do wonder if some of the stigma is almost entering into the physician's thought pattern without them realizing it, and them being reluctant to put the true diagnosis, which is Alzheimer's disease, on the chart, because then it opens up that discussion that they have to have about why they believe it's Alzheimer's disease, how they're certain, because that is the one diagnosis that most people will fear.
I think that the topic of stigma and fear from both the doctors and the patients are strongly related. And in the case of the patients or the people, the individuals that might get this diagnosis, even when there is this suspect in the family, there's something wrong with me or with my father, what could it be? The fact that there are, that the diagnostic pathway in many countries is so long and uncertain, and the fact that there is no treatment yet, I think is really adding to this fear.
I mean, if you look at all subspecialists and specialists, even when you look at geriatrician, for example, in the state, you cannot train enough geriatrician to cover all elderly people in the United States of America or Europe for that matter. Same with dementia. I mean, you cannot train enough specialists in dementia as a neurologist or psychiatrist, dementia specific. You have to train the primary healthcare team, in particular the family physician, the general practitioner, how to deal with dementia. I mean, and it's easier, much easier, and the number is there. You already have enough family physician, enough primary care physician to take care of dementia patient, provided they receive the good training and the good instruction. And you'll have, of course, the specialist that is sitting there in case you have a sophisticated dementia case that you need to refer to.
I think that we don't need more specialists. I think that we need more knowledge and broad knowledge across different specialties, also to educate nurses, social workers, and I think the community as a whole. I want the families to know what to do what they have with a patient with cognitive impairment, and what are the symptoms that might help them to identify a person that could have a neurological disease. So this is something that we should be educating in the schools to children, so everybody knows about this.
Yes, I agree completely that this is important from a general practitioner perspective. But I think that we need a few more neurologists and psychiatrists too, so that the regions can be organized in a way that the GPs can ask for advice.
We always will need to have a network of, nurses in the field, social workers. I like the idea of even, non-healthcare people that are specially trained so that they're in the communities helping patients get the information that they need, and then getting to the specialist when it is necessary.
If we learn from other type of illness, it's every clinician's responsibility. It's 1 in 4, 1 in 3 hospital beds now occupied by elderly in hospital, and many of them, they have diagnosis of dementia or could have diagnosis of dementia, and therefore just improving the knowledge one is important.
We definitely need more access to care, but at all levels. And this whole conversation we're having just reminded me of two things. One is that actually this conversation is exactly the same that happens also when we talk about migraine, for instance. That it's profoundly underdiagnosed, and so should we have more specialists in migraine, or should we have GPs that are trained to recognize migraine and help? And it's always the same conversation. And I think the day we will have blood-based biomarkers and very clear workflow of what to do, like algorithms for GPs, I really do think that GPs, ideally even pharmacists, really at the community level, there will be much more support, and we will not need all these neurologists. So that would be my vision for the future. But I think what we have right now is not enough.